Sounds good. All right, everybody. My name is Patty Abril with the Mayor's Office of Communications. Hope everybody's doing okay today. As you heard, the doctors and medical experts' time is limited this morning, so we want to go ahead and get started. So, Mr. Mayor, take it away. We need to unmute the mayor. Can we unmute the mayor, please?
Yeah, he did it.
Okay, here we go. Good morning, everybody. Boston County's medical experts have joined me today to share what they know about the recent COVID-19 spike and the steps that we're taking to tamp down the escalating curve. I continue to make decisions based on their advice and the available science. They have been involved in every reopening work group, not the lobbyists, not the politicians, but the medical experts. Our doctors are busy saving lives, and many of them need to leave in the next half hour, so I've asked them to talk about how they see things and then take any questions from you. This is your opportunity to focus on what the doctors are saying, why we have closed interior spaces of restaurants and other places, and are requiring masks for indoor gyms. We're focusing on the science and not all of the political posturing that is hurting our county's ability to tamp down this virus. The medical experts with us today are Dr. Lillian Abo, an infectious disease expert at Jackson Health, working in conjunction with the University of Miami Health System. Dr. Tanita B. Ferreira, the Chief Medical Officer for Inpatient and Acute Care Services at UHealth. Dr. Eileen M. Marty, an infectious disease expert at Florida International University's Medical School. Jackson Health System President and CEO Carlos Migoya. And from the Florida Department of Health, Dr. Yesenia Villalta, who leads the Miami-Dade offices at the Florida Department of Health, and Dr. Samir Elmir, who directs the Division of Environmental Health. Patty, you can start calling on each doctor and coordinate the questions to them from reporters in English and in Spanish. After you all speak to the doctors, I'll answer any questions that you may have, first in English, then in Spanish. Let's give the doctors the opportunity to speak and answer questions, because they do have to leave in about half an hour. Thank you. Patty?
Thank you, Mayor. Okay, so since time is limited, we're going to hear from the doctors, and I think we can maybe do one question in English and one question in Spanish from each one of the doctors, and then move on to the next one, so that way everybody gets a chance to share in their specific expertise. I don't know that Dr. Abel's on the line yet, so we're going to go ahead and get started with Dr. Ferreira. Dr. Ferreira.
Well, thank you, Patty, Mayor, and others for having us. I think we're still seeing an incredible amount of cases, and we're seeing triple numbers of cases at this time as we've seen back in March and April. And obviously, we've been working very closely with the authorities for us because we're on the back end. And I'm an intensivist by training, and our number of cases have simply tripled in size, as I said. We are running essentially two hospitals, a COVID and a non-COVID hospital. And this is a very similar situation in comparison to other hospitals in Miami because we're all communicating and talking very frequently. I think the issue is the principles of spreading of this virus has not changed. The scientific evidence is very clear. It's person-to-person spread. It is on the behavior of the people by not wearing a mask, by not adhering to social distance and other forms of hygienization. And with that, we knew when we came with a robust plan of the city to open the city and came in phases. As we reopened, like we saw with many other cities, the number of cases start to increase. And obviously, we have requested to go back to the mayor to evaluate those plans and to see what can we do outside, because at the hospital end, we're seeing a surge of cases in planning. And I'll turn to Dr. Marty so we can talk a little bit more on the evidence in terms of airborne transmission and droplet, because I think it's very important to make that distinction. Dr. Marty, can you assist me, please?
Okay, Dr. Marty is muted. Okay, she's there. Now, we initially thought we would hear from each doctor and take a couple of questions for that doctor. Is that okay? We do it that way, and then that way we can move on to each one.
So, Dr. Pereira, thank you very much for your It's always a pleasure to work with you. She's absolutely right. There are multiple factors that have led to us being in the situation that we're in, which is extremely grave. Yes, there is growing evidence, and there has been over the last 2 months, that there is a significant amount of virus that is in aerosol. In other words, 5-micron size.
Teeny tiny droplets, and these accumulate when people just breathe, and that has to happen when we are anywhere. And if we're not wearing masks, as happens, for example, in indoor spaces such as restaurants, we run into this major problem of accumulating amounts of virus that's floating around in the air, which makes those indoor spaces very, very dangerous. But I want to reiterate one thing that Dr. Pereira says. We are here for a plethora of reasons. Number one, and the most important, is public perception of this outbreak. They have not taken it seriously enough. They have not wanted to adhere to the new normal guidelines. They have not wanted to wear masks, way too many people. And they have been in those closed spaces without doing the appropriate precautions, and that's the main reason that we are where we are. There are other reasons, of course. We do need more contact tracers. We do need better contact tracing questionnaires. We do need more testing capability with a much faster turnaround time, and we do need to have more staff that has the knowledge, such as Dr. Pereira has, to manage an ICU, nurses, doctors, etc. And everything is a comprehensive plan. It's not one thing, it's all of it combined.
Thank you, Dr. Marty. Does anyone have a question for either Dr. Marty or Dr. Ferreira at this point? We can go ahead and do the hand raising on Zoom.
I'll tell you what, Patty, why don't you let the doctors go through, and then the questions they can kind of pinpoint
to whom they want to address and answer the question. Okay, that's fine. Then we will go now with Dr. Abel. Good morning, Doctor.
Good morning, everyone. First, I want to reiterate what my colleagues have said multiple times and again today. This is everyone's work. We are in this together. We need a unified response. I know there are many challenging questions. Why are we doing this? Why are we doing that? Everything we're doing is taking our community, public health, and public safety into account, and balancing that with reopening the economy and making sure that everyone can continue to provide from their homes and their households, at the same time make sure that our hospitals are not collapsing. We currently have hospitals that are full. We're able to care for patients with COVID and non-COVID, but every healthcare worker is working nonstop. Our workforce is also falling sick as they're getting infected as well in the community, and many people are getting infected around us. So we really need to work in this together. All the measures that are being put in place are for your safety. And the social distancing, the wearing the mandatory mask, and staying at home whenever you can, it's more important now than ever. So I want to mention, and I want to thank everyone today for being in this call. We need your help as media communicators to help the community understand that we're just not being, repeating the same thing over and over just to give you trouble. We really need your help. Miami is now the epicenter of the pandemic. What we were seeing in Wuhan 6 months ago, 5 months ago, now we are there. So we really need your help.
Thank you, Doctor. Let's move on now to Mr. Migoya. Are you here? Okay, he's not on. Dr. Vialta from the Florida Department of Health. To you.
Sure. Good morning. Thank you, everyone. I'll be talking about the perspective in terms of public health. I really would like to start by highlighting that Mayor Gimenez and colleagues here today working together with the Florida Department of Health in Miami-Dade have been working together to help stop the spread of the COVID-19 within our community. From day one, protecting our citizens from this virus has been our main priority. Public health is everyone's responsibility, and together we can fight COVID-19. We thank those in the communities that have been following the guidelines and urge others to do so. There are things in place that each one of us can do. Okay, we can wear our face mask in public, we can social distance and avoid the 3 C's, which is crowded places, closed spaces, and our close contacts. The best way to prevent illness is to avoid being exposed to the virus and avoid exposing others to the virus by practicing social distancing, practicing hand hygiene, wearing a face cloth while in public, avoiding touching your eyes, nose, and mouth, and definitely to cover your nose while you're sneezing. Also to clean and disinfect high-touch surfaces, and definitely, like Dr. Abu mentioned, to stay home with your sick. As soon as you begin exhibiting signs and feeling signs and symptoms of COVID-19, you should let your immediate family and those that you have been in close contact with so that they can take the necessary precautions. If you have been tested for COVID-19 and receive a call from the Florida Department of Health contact tracer, talk to them. Talk to them about your test results and let them know who you've been in contact with and who you may have been infected. The contact tracers will also seek information on where you think you were infected and the type of work that you do. When you have widespread community transmission, as we do in this community, contact tracing is helpful to determine if that person has been exposed to other individuals and to groups of people. If they are in home health aid, if they're working in a nursing home or other facilities that may deal with vulnerable and fragile individuals, to help prevent an infection of those individuals. Contact tracers will be asking you questions that we really need the answer so that we can work together to stop spreading the virus within our community. By answering these questions, you can protect others and will be contributing to stopping the spread of the virus. You can also be contacted by a Florida Department of Health contact tracer to let you know that you may have been exposed to a COVID-19. We have been seeing infections in younger individuals, and younger individuals also act as transmitters, others including the more vulnerable population. So let's think about our parents, our grandparents, our family members, our neighbors who are older or have underlying health conditions. We all want them to be safe. As we move forward, it is important for all of us to take our part in continuing to take the steps to prevent further transmission of COVID-19 within our community. Everyone can take steps to protect themselves, their families, and our community. Each one of us can help spread the virus, can help stop the spread of the virus. COVID-19 prevention remains our number one goal. Number one, social distancing, frequent hand washing, and all those other measures that I mentioned previously. I salute all of you for you keep on doing what you're doing to continue our community to be healthy. And I urge those of you who haven't to please call and follow the directions and follow the messaging of preventing COVID-19 within our community. Thank you.
Thank you, Dr. Villalta. Dr. Elmir. Here. Dr. Elmir, there we are. Good morning, sir. Oh, I think you've muted.
Good morning.
There you
Yes,
go.
my position basically has been stated by the health officer and administrator for the DOH in Miami-Dade County, Dr. Villalta. I think in addition to this, I agree with everything being said by our medical experts, Dr. Abu, Dr. Fiera, and Dr. Marty. In addition to this, I would like to say that I was looking at the data quickly and evaluating this. It seems very obvious. The problem is easy to resolve. Just we have the guidelines, very solid public health guidelines put together for the county. Just we need to unify the message. Just we need to follow these guidelines. All of us at all levels in this community. Let me give you an example. For example, between May 31st and June 7th, we were below 10% infection rate. After that, between June 7th to basically June 28th, about 20 days, the slope for the positive rate was very steep. It went from less than 10% to more than 20%. And we know what happened after that. After May 31st, we have, Memorial Day, we had the protest. And if you go to Google and look at pictures, what happened in Memorial Day and what happened during the protests in Miami-Dade County, you will see a lot of people did not adhere and did not respect to the public measures that they were put in place. So we know what the problem, where the problem is. Just we need to follow it. Just to show you a little light at the end of the tunnel, I was looking at the data between basically June 28 and now, July 11. I don't have the data for July 12. The slope, because we implemented some measures, basically closing indoor dining for restaurants, closing beaches before July 4th weekend, and so on and so forth. This is, preliminary data. The slope for this, for the infection rate or the positive rate has been reduced, while we still have high numbers, reported cases, but the slope has been reduced significantly as compared with the period between June 7 and June 28. So we know what the problem is. We just need to unify the message, follow the public health measures that we put in place in terms of social distancing, in terms of face covering, in terms of facility hygiene, in terms of personal hygiene, washing hands, and so on and so forth. So, and I support everything being said by our medical experts and also by my, the health officer for the health department. And in addition, finally, while we still considered a hot zone in Miami-Dade County, I think, and I've been, reviewing all this data, most national medical experts and public health experts do agree that indoor gatherings and private parties are causing these problems. That's exactly what happened with us. Including like indoor dining in restaurants, bars, nightclubs, so on and so forth. We are on the right track. We just need to follow the guidelines, all of us as a community, and we need to work together. And I support the effort by our mayor has been non-political at all, following the science. And I would like for him to continue on the same path. Thank you so
much, Doctor. Thank you very much. Now we'll start taking some questions for the doctors. Again, since their time is limited, and Mayor Gimenez will answer your questions after that. Our first question is going to be from Christina Vasquez from Local 10. Christina, go ahead and unmute.
Good morning. Can you guys hear me?
Yes.
Oh, perfect. Thank you all for being here. I did have a question for you all, especially on this week when it comes to, and you touched upon it a little bit, when it comes to the lab capacity issue. So there's a testing capacity issue, but one thing that I think Carlos Magoya is here too, from Jackson Health, he had sort of flagged this on a virtual call just a few weeks ago with the county commission about the delay and results that we're seeing as labs are overwhelmed and there's a backlog because of all the samples. So it's a two-pronged question for whomever of the medical professionals can answer it. One, helping our viewers, fleshing out and helping our viewers really understand why having a delay in results hinders our ability as a community to really tap down on transmission. And then two, can you help me and others understand what's needed to assist with this backlog when it comes to the labs? Is that at the state level? Do we need more investment in folks at the state-run labs to process it? I think I've also heard Carlos Magoya mentioned it could be also on a national stage. What investments do we need as a community to bring those results times down?
One of the key reasons that we need more labs and that we need testing to be turned around quicker is because the longer you delay, the more psychological problems it causes, and it slows down the chain of reaction that we need to accomplish in order to entrap the virus. So it halts appropriate management of the disease and containment of the virus by not having fast, rapidly turned around, accurate testing. And we are maybe at about 17% in Florida of the level of testing that we actually need to do to accomplish getting the virus under control. So we need more labs, we need more equipment in the labs, we need more trained personnel in labs, we need more kits for the equipment that we have so that we can get that turnaround faster.
Thank you, Dr.
And
Marty.
in terms of, is that a state-funded resource? Like, are we looking that, is that something that through the CARES Act funding, the state of Florida received, the Department of Health should be making those things happen for us, given that we are the leader in the state? Or do we need even more federal funds to make that happen? What's preventing us from currently doing what you say we need to do when it comes to improvements in lab?
So I think the question is a two-pronged question. We're seeing delays in commercial labs and in state-funded labs. And within our hospitals, we have been facing challenges. As the economy reopened, we are, since April, testing everyone coming to the healthcare center to know if they have COVID, even if they don't have symptoms. Back in March, we were only testing based on CDC guidelines if you had symptoms. Again, I do think this is a national response where we need more help. If we had tested nationally, everybody way back in February or March, yes, we probably could have halted the disease much sooner. I always bring the analogy of HIV. Back in the 80s, if you didn't know you had HIV, people were having unprotected sex and infecting many other people where they didn't know they had symptoms. I don't feel anything, therefore I can go and live a free life and be with whomever I want. And millions of people worldwide were infected, including mother to child, and you know the pandemic of HIV. I don't need to explain it. So the same analogy applies to COVID. If you don't know that you don't know what you don't know. So testing quickly allows me to know, hey, I have it. I need to protect myself and protect others because I don't want to start infecting people. And one person can infect 10, 20 other people without knowing it. So testing capacity needs to be happening and fast. And this is the PCR test, not the serology test. That's very important. And yes, we do need more supplies, more reagents, and we need people to stop the chain of transmission so we don't run out of supplies and people who can run these tests.
And if I may just
Thank you very
add,
much. Let's get a Spanish question in now from Ana Cuervo at Channel 51.
Dr. Pereira, I wanted to add something.
Oh, I'm sorry, Dr. Pereira.
if I just want to add, for the general public, if you are going to get tested because you have symptoms and your test is delaying being resulted, please isolate yourself and follow the infection control measures to stop the spread. Each health system has developed their own platforms for testing, well, like the did, Jackson did. We're able to test over 500 patients a day, but certainly the state and the DOH needs assistance in having those reagents and having a step up on the lab for the community.
And let me just add one more thing. Once you know that person A is positive and you have contact tracing, you can get to the people that person A has affected, B, C, and D, who may have no knowledge that they've even been exposed before they have symptoms and before they start spreading to other people. This is how it works. This is why we need a comprehensive approach with all the pieces in place. The testing to the maximum and the speed, but also the contact tracing to the maximum and to the speed.
I have a
Thank
question
you.
because I want to make sure that that we all understand that contact tracing, testing, those are all tools, they're important. But the number one thing to reduce this virus and the level of contagion in this county, and actually probably in the country, is the way that we act and the precautions that we take as individuals. That's the number one way to reduce the virus. And then, yes, have all these tools in place, but I don't want to get that message muddy that, hey, somehow we add a whole bunch of contact tracing, the virus is going to go away. This virus will not go away unless we change our behavior. We follow the rules, we keep our mask on, we have social distancing, we wash our hands. At least that's my opinion. Hopefully the doctors can chime in on that.
We absolutely agree. We need the testing, but we need to change behaviors. We can give you all the restrictions to stop smoking, but if you keep smoking, we don't do anything with more testing for lung cancer. So you need to quit smoking to prevent cancer.
And we need everyone to do it. We need a whole of government approach. We need everyone to be having the same message and for people to be understanding the science as much as we can get them to understand it.
I completely agree. From the public health perspective, I'm sorry. From the public health perspective, I completely agree with the mayor and our medical experts. Prevention, in order to break the cycle of the transmission, you need to do the prevention. I mean, you can use all the tools in the world in terms of contact tracing, in terms of testing and laboratories and so on and so forth. But before we get sick, we need to follow the proper public health guidelines. We talked about them. We mentioned them one by one, and they are in the guidelines. And everybody in the community should follow them, because we know that more than 50% of the population of the cases, they get generated from people that they don't have symptoms. We need to assume everybody in the community has COVID-19 so we can follow the proper prevention. Assume everybody around you has the virus, and protect yourself and protect your family and protect others. So follow public health guidelines in addition to the tools referenced.
Thank you so much. Now let's get that first Spanish question in from Ana Cuervo at Telemundo. Ana? You're muted again, Ana.
How about now?
Yes.
Para cualquiera de las doctoras que ha estado trabajando de manera cerca con el condado, algunos oficiales electos han cuestionado que no hay evidencia científica que indique que el aumento de casos vino de los restaurantes o de los gimnasios. No para entrar en ese argumento, pero porque pudiera afectar nuestro comportamiento en la comunidad en las próximas semanas. ¿Por qué decidieron hacer cambios en este tipo de negocio en específico?
Porque esa no es la pregunta correcta. La pregunta correcta no es si eso fueron culpables o no. La pregunta correcta es si es un riesgo tener esas cosas abiertas. Por eso, doctor Ferreira, el principio de esto habló de aerosol transmission. Eso es sumamente importante, entender que en un espacio cerrado, la parte de adentro de un restaurante, por ejemplo, especialmente en una situación cuando las personas, para poder comer y tragar las cosas, tienen que quitarse las mascarillas, empiezan a aumentar la concentración de virus a un nivel que es peligroso, simplemente peligroso. No es porque tienen culpa o no tengan culpa, es que se han puesto en un lugar muy peligroso por el nivel de positivo que tenemos en nuestro condado.
Gracias, doctora. Let us get another question now back to English. We'll hop back and forth. We have Veronica Zaragovia from WLRN. Veronica?
Thank you so much. I wanted to follow up about how, because a lot of the reality is that a lot of people don't necessarily listen to the news or listen to WLRN. So I'm wondering, how are you following up with enforcement in terms of either plans or wearing their masks? Just a little bit about how are you following up?
Enforcement is an issue for me. It's not a medical issue. The enforcement, yesterday we did 6,000 inspections, and Miami-Dade Police Department handles the unincorporated areas, although we can go into the cities. Yeah, we're focused on enforcement, and we're also bringing up an item before the commission to start giving the civil citations. Right now, a violation of these rules is actually a criminal act. We want to make it easier for other inspectors to go ahead and hand out tickets and the ability to close businesses, etc. We need everybody to wear their masks. We need businesses to comply. We need us also in our personal lives to change our behavior. That's difficult to do on an enforcement level. When you can't go into a house, you can have a house party. It's really difficult to stop. The message needs to be put out that, hey, we need to change our behavior. We need to keep away from each other. We need to assume that everybody has the virus, because we have a large number of people in this town that have the virus. But enforcement is a big aspect. But we also have to have self-enforcement. We need to enforce ourselves. We need to be good citizens. We need to safeguard each other. So I protect you, you protect me. That's going to be a heck of a lot more effective if that message gets through than any enforcement that we do at this time, although we are focused on it.
Mayor, do you want to mention the phone number where people can call? Because I do think the community needs to know that if they see bad behaviors, we are backing them up. And there are numbers where they can call.
Yes, there is. The number is 305-4, the number 4, and then police. 305-4 police. If you see, especially businesses and all, that you see an area where something's going on, let us know. And then we will get on it and we will enforce the rules. We do. But all of us also have to have a little bit of peer pressure about enforcing the rules too. All right? So it's not okay to take off your mask in front of me. Thank you very much, because you may have the virus. As a matter of fact, I may have it. And so that's the message that needs to be driven home, and the message that we need to take to the community so that we can start to drive the level of contagion down.
And is the county, do you have any data on how much, like, are you receiving these phone calls more, like an increase in phone calls from people that are helping you to find out about businesses that aren't complying?
We're getting phone calls. We know that. I just want to put that number out again. 305, the number 4, police. 305, the number 4, police. Give that if you see something, let us know, and we'll get on it.
Thank you very much. We're going to take another. ATV is Ronald Acha. Ronald.
Gracias. Quería preguntarle justamente a la doctora Ao, me llamó mucho la atención el hecho que ha manifestado que nos encontramos en el punto que somos el epicentro en el país de lo que viene a ser el coronavirus o el COVID-19, y asimismo el trabajo de los rastreadores, ¿no? Había manifestado que el trabajo que estaban haciendo de una u otra manera no era el adecuado, que se necesitaba en todo caso un mejor cuestionario. ¿Podrían por decirme eso justamente en español? Gracias.
Sí, en estos momentos estamos viendo que nosotros somos el epicentro de la pandemia a nivel de los Estados Unidos. Florida está teniendo el mayor número de casos y todo lo que es el sur de la Florida, Broward, West Palm Beach y Miami-Dade County, tenemos un alto porcentaje de pacientes hospitalizados en cuidados médicos y cuidados intensivos. Esto es sumamente preocupante y tenemos todos que tener la obligación de cuidarnos. Como se ha mencionado anteriormente, hay 3 cosas muy sencillas que todo el mundo debe hacer. Quédate en casa. No salgas si no tienes que salir, y la gente que puede trabajar desde su casa tiene que hacerlo. Evitar el contacto cercano, mantener el distanciamiento social todo el tiempo y el uso de las máscaras. El contacto, el contact tracing se está haciendo. No se puede hacer siempre a la velocidad que se necesita por diferentes motivos. Y en estos momentos, con 25% o más de la población infectada, porque 25 es los que les hemos hecho la prueba y han estado positivos. Hay otro porcentaje que está asintomático, infectando a otras personas. Entonces, necesitamos pruebas, necesitamos cambios de conducta, y hacer este rastreo se está haciendo en los hospitales y estamos tratando de cambiar el tipo de preguntas que se hace para tratar de entender en dónde ha estado esa persona en los últimos 15 días. No es fácil hacer este rastreo. Por lo tanto, es muy importante mantener estas medidas de distanciamiento social. Y lo repetimos hasta que la gente se cansa de escucharlo, porque va a ser la única manera de bajar esta curva y evitar que nuestros hospitales colapsen y evitar que cada uno de ustedes y sus familias se enfermen.
Gracias, doctora. Ahora vamos a pasar a otra pregunta en inglés. We'll switch back to English. Carlos Suarez, NBC6.
Good morning, everyone. My question is simple. It seems that we're all in agreement here that everyone, the attitude should be we should assume everyone has the virus, and that those waiting for a test result should self-isolate. So my question is, do we need to revisit a stay-at-home order? It seems that seems like the natural progression of things. And so I'm wondering if we're to assume that everyone has it, and if folks are waiting at least a week for a test result, then shouldn't there be a blanket order saying everyone should just stay home?
So we closed indoor dining and look at what has happened. I can only ask Mayor what will happen if we order a stay-at-home order from everyone again. We have been trying to balance, and this is the million-dollar question. I think this is a question for Dr. Fauci, because nationally, yes, I would think if I wake up today, I say, wow, if everyone stays at home, I know we will control this faster. The question is, how do we balance that without having more millions of people losing their jobs and not having, the money to pay their meals and having a roof to sleep? So this is, for us, is a huge responsibility. It's an ethical question. And yes, I would love to order a lockdown. However, we're trying to prevent that because we understand how important is the economy. And not just the economy to make money, it's people who really need money to pay their day-to-day bills and survive.
Look, we had this question last week, and with many of the doctors that are here, and I asked that question. And And what they advised me was, let's see what happens. We need to take about 10 days to see if the measures that we've taken start to reduce the level of contagion. So, we're not there yet, but everything is on the table. And I don't want to take, I don't think anybody in this call wants to take that drastic measure because of the consequences that it has on people's lives. The simple act of just closing the indoor dining room spaces has caused great controversy, and unfortunately, it did. But there's no question that it was a necessary step. We also closed banquet halls, and we closed casinos, and we closed movie theaters. It wasn't just the restaurants. These are interior spaces where large people would gather. And so those are the things that we did, trying to, as much as possible to maintain as much of the economy open as long as we do it safe. And we feel, and I feel, and I think the doctors feel, that if we simply follow the rules and keep our masks on and keep our distance and wash our hands, that what we have open can be done in a safe way, in a relatively safe way, with low risk of infection, if we simply follow the rules. That's all we're saying. And so right now, I don't have any intention of going further because my doctors, my advisors said, we have to see what these steps have taken and if we start to drive down the contagion. And so, but we're always talking and we're always looking for new measures and we're always looking at the data.
Thank you, Mayor. Now we're going to switch back to another Spanish question, this one from Erica Carrillo from Noticias 23. Erica?
Alcalde, buenos días, ¿me oye?
Sí.
Ok, alcalde, este fin de semana particularmente recibí 2 quejas. Una de varios, no uno, 6 empleados que se contactaron conmigo de diferentes formas de goodwill.
Erika,
una de ellas casualmente.
Erika, las doctoras y los expertos médicos se tienen que ir pronto. El alcalde va a seguir en línea después de que los doctores se vayan. Si tienes una pregunta para alguno de los médicos,
la pregunta para el alcalde
después. Dime.
Perfecto. La pregunta para el alcalde, así que yo espero, tranquila.
Ok, perfecto. Entonces, para otra más en español, para los médicos, veo a Sabina. ¿Cómo? ¿Es en español la pregunta suya?
Sí, en español. Hola.
Para
cualquiera de los profesionales médicos, la pregunta es si entendimos bien después de la explicación que ya dieron. Estamos viendo el problema más por la manera en la que las personas se están comportando y no porque abrimos demasiado rápido.
Esa es la razón principal, que las personas cuando empezamos a abrir no cumplieron con la nueva normalidad que había puesto en efecto el alcalde. Y eso es sumamente grave. No le dieron la importancia al virus, no querían usar las mascarillas. Esa es la razón principal por qué estamos en la situación donde estamos. Ahora, las otras cosas, porque tiene que ser una cosa comprehensiva, o sea, todas las partes tienen que estar en lugar. Y hay otras cosas que tenemos que arreglar también, pero eso es lo principal, sí.
Es multifactorial, completamente de acuerdo con la doctora Martí. En algunas ciudades, en algunos estados, sí se vio que hubo una reapertura precoz, donde no había un plan de reapertura concreto y estricto. Nosotros hemos trabajado durante meses en el plan de reapertura que incluyó a todos los expertos de todas esas áreas, desde hoteles, restaurantes, gimnasios, todos los task forces fueron multidisciplinarios. Y el plan, que tiene más de 200 páginas, es un plan que yo sé que es muy largo de leer, pero es un plan muy, muy, muy detallado de cómo hacer las cosas bien. Entonces, si las cosas se hacen bien, no tenemos que culpar a nadie, somos todos responsables. El problema es el que todo el mundo quiere hacer lo que quiere y todo el mundo sabe más que los demás. Entonces, volvemos al punto, no es todavía muy tarde para revertir el proceso, pero si esto sigue, vamos a tener que tomar otras medidas.
Muchísimas gracias, doctora. I understand that Mr. Carlos Magoya has now officially joined us, and I know some comments that he was going to speak on. Dr. Marty, you need to go? I see her waving. Thank you so much, Dr. Marty, for joining us. Do any of the other doctors need to go? If you can stay on a little bit longer, please do.
I need to leave in 5 minutes, Patty.
Okay. Thank you, Dr. Ferreira. Okay, Mr. Magoya, are you there? And did you want to share some information with the media?
Thank you, Patty. Thank you very much for allowing me to speak. and I know that many people keep asking if the hospitals are full. The hospitals right now are fairly full. We're running around 90%, which is considered full. But what's capable and what's important for everyone to understand is that we're managing the number of patients in beds on a regular basis. At Jackson specifically, we have doubled over the last 30 days the number of patients. We went from 200 to 400 patients that are COVID positive. But in the meantime, the total number of patients in bed has not really changed. We're running in the 1,350 range total. What that means is that we have a higher percentage of COVID patients in the hospital than we used to have. And that is the management that we have to continue to do. As long as we continue to discharge other patients by reducing elective surgeries and not having to use as many ICU beds and regular beds and so forth, and reducing those patients, then we can allow other COVID patients to come in. And that's been the case for the last several weeks. We are obviously very challenged by all that's going on, and there's a lot of stress. We actually have already hit 4 months that this has been going on. So actually, that's part of the challenge that we have. But this continues to be how we're managing this, and we're looking and expecting the number to continue to grow. I think both Dr. Abbo and Dr. Marty both said it very well, that the issue is more enforcement at this point in time when you have people out there that are aggressively, and I repeat, aggressively saying they don't have to wear masks and not have to be socially distant. Those are the kinds of people that are spreading this kind of disease and making it more difficult for hospitals. So from that perspective, we think that we have done enough from a closure standpoint, as long as people abide by the rules. And if we do that, we should be okay from a hospital perspective. But we need to make sure that we continue that. And as the mayor said, if we enforce these issues, we believe that over the next 2 to 3 weeks, we should see the peak of where we are. And that's what we need to make sure that the communities all help out. And so that's really all I have to say, unless anybody has any specific questions of me.
Does anyone have a question specifically
Sí,
for Mr.
¿puedo
Migoya?
preguntar? Erika Carrillo. Señor Migoya, buenos días. La pregunta para usted o también para alguno de los médicos de UM. Cuando hablamos de las camas, la gente siempre se asusta, sobre todo en la disponibilidad en cuidados intensivos. Quiero preguntar dos cosas. ¿Estamos en el pico o los casos todavía pueden aumentar más y el pico todavía no lo hemos visto? Si no hemos visto todavía el pico, ¿qué va a pasar? ¿A dónde se va a adecuar un lugar nuevo en caso de que se acaben las camas de cuidados intensivos, tanto en los centros privados como en los hospitales públicos?
Gracias, Erika, por esa pregunta. Principalmente no hemos llegado al pico y no esperamos llegar al pico por lo menos por 2 o 3 semanas más si se mantienen las cosas comunitariamente controladas. Eso es muy importante, que se mantengan controladas. Los hospitales están bastante llenos, están en un 90% en estos momentos, pero hasta este momento, y esperamos que podemos seguir en el futuro, podemos estar dejando ir pacientes para la casa y reemplazar a esos pacientes con pacientes que tienen COVID. ¿Qué quiere decir? Que la proporción de pacientes de COVID en los hospitales va a incrementar por las próximas 2 o 3 semanas. Eso se puede mantener mientras haya un sistema controlado. Si esto fuera de control, y repito, estamos en control por el momento. Si se mantiene fuera de control y hay demasiada infección, entonces vamos a tener problemas. Y por eso es que el alcalde y todos los médicos están hablando de que es importante que de todos estemos manteniendo la distancia social y máscara, y que no estén, por favor, allá afuera sin máscara y sin distancia social.
Muchas gracias, señor Migoya. We still have Dr. Abbo, I see Dr. Vialta, Dr. Ferreira still on, so we'll take a couple more questions for the doctors, and then they can leave if they need to leave.
¿Sí podría preguntar?
Vamos a pasar a inglés ahora y entonces después regresamos.
Okay, perfecto.
Let's see, Glenna Milberg, Local 10.
Morning, everybody. So my question is, what seems to be here are 2 major headlines. One is the messaging that all of these behavioral components need to be followed. The other is that there is not enough testing and contact tracing to possibly get a handle on where we are at the moment. So sort of a 2-pronged question, just like it in both. Why not make testing mandatory? Right now it's voluntary. Some people get 2 or 3 tests, some people get none. Why not make testing mandatory for everybody? And number 2, if it's still a criminal issue for enforcement, how many people have been cited, fined? I know there have been no arrests, but enforcement, if you think of a criminal law, crimes are not allowed, yet we have crimes every day. So this crime, unmasked and social distance crimes, are absolutely happening every day. We all see them. How, practically speaking, is that enforcement even possible, and has any taken place already on a personal scale?
Well, actually, we do have an arrest. Yesterday, we issued an arrest for somebody who was operating completely out of the bounds, operating a business that should not have been open, so they were given a notice to appear, which is like an arrest. And we have closed down numerous businesses on a daily basis. We close down 5 or 6 businesses on a daily basis. Individual mask wearing, that's why we need the tool of having a civil citation. It's pretty difficult for a police officer to come in and give you a $500 fine and a notice to appear because you weren't wearing your mask. Civil citation will make it a lot easier for inspectors to do that. And so, but also, look, there are laws on the books. We have, you're not supposed to kill people, but yet people get murdered. You're not supposed to be speeding, people speed. And so, it's enforcement, but it's also, we have to comply with our own laws. And so, on the issue of testing, Glenn, if we said everybody in the Miami-Dade County had to be tested, that means you have 2.8 million people that have to be tested. The capacity is not there. We have a certain amount of capacity. We're increasing that capacity all the time, but not enough to really test really quickly 2.8 million people, and the technology is not there. And so that's really problematic. So right now, people can get tested when they desire to, or they have symptoms. And they have symptoms, they can go to a private lab, and their doctor can give them basically a prescription for a test. But that is a problem. But again, the one way to reduce the contagion here is how we act, keep socially distanced, mask wearing, et cetera. The testing is a tool. Contact tracing is also a tool, but it's not the main way that we're going to be controlling this.
Can I just ask a follow-up? You said reference a police officer stopping a person on the street and issuing a fine. And, I can see how difficult that would be, but would you entertain the notion that the first time that happens would be a really big message to anybody watching? We would all cover that. That's the message you want out there. Somebody was just arrested for not wearing a mask. Is that, in your opinion, too far to go to send that message?
I think we need to send a message, but that's why we're asking for that tool that makes it easier to send that message. So you get a $50 ticket when you're not wearing a mask outdoors. It's a lot easier for our inspectors to also issue that citation. So we need to get that legislation done. Hopefully on the 16th it'll pass. It'll take 10 days to take effect, and then we will be able to do a better job of enforcing this the regulations and the rules that we have in place. Right now, it takes a police officer to do that because it's a criminal act.
Could the mayor repeat that in
Let's
Spanish?
switch back over to Spanish, and please ask questions of the medical experts because they do have to leave shortly. So we go now to Paola Serna.
Hola, buenos días. Quería preguntarle a alguna de las especialistas, muchos estados han decidido retornar a la fase 1, volver a todo el mundo a sus hogares y solo salir para necesidades básicas. ¿Qué hace falta para que Florida vuelva nuevamente a la fase 1? Y también el tema de las fiestas que se están realizando dentro de los hogares. Hemos visto muchos reportes este fin de semana de gente haciendo fiestas dentro de los hogares. La advertencia de ellas a este respecto.
En respuesta a la advertencia, lo hemos dicho innumerables veces, tanto personas haciendo fiestas en botes, yates o casas privadas. Esto es una irresponsabilidad y, como dijo el alcalde, él no tiene la autonomía a nivel legal de poder entrar a casa de nadie y cometer arrestos. Esto en estos momentos no es posible sin un search warrant. Entonces, esto para nosotros es sumamente grave porque no son jóvenes que están haciendo esta fiesta, son adultos, es todo el mundo y este es el ejemplo que le estamos dando a nuestros hijos y a nuestra futura generación. Entonces, no queremos cerrar la economía, No queremos que la gente pierda sus empleos, pero a la misma vez la gente tiene que actuar responsablemente y asumir que el hecho de que no te vengan a multar no quiere decir que uno va a salir a manejar borracho. ¿Ok? Esto es la misma analogía que salir a manejar borracho. La gente tiene que asumir la responsabilidad. El hecho de que prohibamos la venta del alcohol no quiere decir que la gente no se puede emborrachar en su casa. Entonces, tienen que asumir que aquí la responsabilidad es urgente, estamos en una crisis y necesitamos que todo el mundo empiece a actuar ya. Esto no es que se va a resolver en 2 semanas, todo el mundo tiene que actuar responsablemente de inmediato. La decisión de cuándo volver a la fase 1 y cuándo cerrar es una decisión que se está tomando a diario, se está viendo, se está tomando con mucha precaución, mucha cautela y mucha responsabilidad. Yo sé que hay mucha gente que nos está escuchando, hay gente que ya me está mandando mensajes en privado acusándome de querer causar una crisis económica. Les digo, yo no quiero causar ninguna crisis económica, yo quiero que cada uno de ustedes mantenga sus empleos y pueda viajar de vacaciones y seguir trabajando. En estos momentos necesitamos de su ayuda. Nosotros, el personal de salud, estamos sin dormir y trabajando sin parar por curarlos a ustedes. Pero si la gente se empieza a enfermar y el personal de salud cae enfermo, no va a ser un médico el que va a venir a atenderlo en la emergencia. Vamos a tener que empezar a llamar a otro tipo de personal a que vengan a atenderlos. Y eso no es lo que usted quiere. Si usted tiene rota la plomería, usted quiere un plomero, no un electricista. Igual en medicina. Entonces necesitamos que todo el mundo entienda que esto es conciencia social y las decisiones se van a ir tomando sobre la marcha. Si es necesario, se van a tomar medidas más estrictas.
Thank you, Dr. Abo. Patty.
We are about 50 minutes into this
Patty, Dr. Pereira wants to talk.
Si puedo adicionar,
doctor, always miss you.
se me permite, la decisión es una decisión basada en números, en data, no es una decisión en un vacuo. O sea, es una decisión muy consciente, no es una decisión alarmista, pero sí se puede adelantar para que se tenga que cerrar. Y tenemos esta conversación con el mayor Sukime diariamente prácticamente.
Otra cosa que quiero también aclarar es que no hay un número. Cuando llegamos ahí se tiene que hacer esto. No hay un libro escrito por eso. Así que esto es una pandemia, algo nuevo. Así que nosotros estamos estimando y vamos, bueno, llegamos aquí, creemos que esto va a ser así. ¿Qué podemos hacer para bajar este nivel de contagio? Así que no hay las personas me dicen, bueno, cuando 2 semanas, en 2 semanas van a hacerte, en 3 semanas. Yo no sé porque nadie sabe lo que va a hacer el virus en 2 o 3 semanas. ¿Cuál es el número? Dame un número. No hay un número. Hay un número ahora que es 10%. Un 10% de lo que es el gating criteria que sacó el CDC y la administración. Pero también no hay números así estrictos que te pueda decir exactamente lo que tú tienes que hacer y cuándo lo tienes que hacer. Eso no trabaja así.
Thank you, Mayor. So we'll go ahead and open it up to questions either to the mayor or to the doctors, as long as they want to stay on the Zoom call with us, if that's okay. So we'll go now to Andy Slater.
My question is actually for Dr. Abo, if she's got a couple of seconds. We know that a lot of people are getting tested right now. What good would you say a test does, especially a negative test, if it's taking 7 days, sometimes even longer, to get that result? What good does that test do?
I understand your question, and it's an excellent question. It's on this side, it's as frustrating as on yours, because what exactly we said is, if I'm going to test someone, is to rapidly stop the chain of transmission. What good does it do knowing after 7 days, when you have been going out for 7 days and potentially, gotten infected again? So how do I know that if I test you on Monday and you were negative, you didn't get infected on Saturday when you went to another gathering? The importance here is, if you're going to get tested, right, either you have symptoms or you were in contact with someone, you need to assume that that test is going to be positive and behave as if that test is positive. And if you don't get tested, assume that you and everyone around you have COVID, regardless of the test. That's the best way to preventing the test from becoming positive. So yes, we need to shorten the time to get the results. And while the state works on that, while the health department works on that, and the commercial labs work on that, we are treating everyone in the hospital as they have positive COVID until proven otherwise. That's how we're handling it.
I understand what needs to be.
In addition to that, Andy, what's important here, and I know that Glenna talked about the fact that we need more testing. Before we need more testing, and yes, we would love to have more testing. It's more important to get a quicker turnaround on the testing at this point in time on the level of testing that we're doing right now, for a different reason. Also, from a public health standpoint, if we get a quicker testing, as high a percentage of infection as we have in the county right now, it lets us know exactly where to focus from an enforcement perspective. And that's important, and we're not doing that today. So I'm not a proponent right now of increasing the number of testing until we get the lab results in a much quicker fashion. That's the number one priority we got right now. And even contact tracing is not efficient for the same reason, because when you're doing the contact tracing and you're doing the testing of those people, it's taking you a week to get there. It's totally ineffective.
Yeah, I was going to say, I understand what needs to be done, but it's not going to be done today. It's not going to be done tomorrow, and it hasn't been done the last 2 or 3 weeks. So isn't that would you say that's a major part of the problem, where people are getting tested, they're getting their negative result a week later, yet they've been around in the community?
I think it's a part of the problem, but the major problem is the behavior. It's how you behave. I go back to lung cancer. I can test you for lung cancer. I can do a CAT scan every day to see if the person has lung cancer. But if the person keeps smoking and they don't change their behavior, at some point that test is going to be positive. And the problem with testing, people need to understand. I can test someone today, but we don't have the capacity to test 2.4 million people every week or every month. So even if you have a negative test today, how often do I need to retest you again? And do we have enough tests to test everyone like that? So we do need to fix that. I absolutely agree. I'm not minimizing that problem. That needs a prompt solution. We need rapid turnaround, and we need everyone to work on producing these reagents, delivering them, and increasing our lab capacity. Absolutely. On the meantime, behavior, and behavior.
Andy, look, you can have a test, get tested. 5 minutes later, you do something that you didn't wear your mask, et cetera, you can get infected. So, as the doctor said, how many times are you going to test you over and over again? We keep looking for a boogeyman. We keep looking for this reason why we have this high contagion. Well, we didn't have enough contact tracing. Well, we don't have enough testing. We don't get it back fast enough. The reason is us. The reason is us. Okay? There's no boogeyman. It's us. I'm sorry. Okay? And so, unless we change behavior, we can do all the tests in the world you want. You can get all the contact tracers in the world you want. It's not going to make a difference. We have to change our behavior, period. Are those tools? Yes, they're tools. Is testing a tool? Yes. Contact tracing? Yes. But the number one reason is our behavior. The number one reason this thing shot up in the middle of June was our behavior. That's what happened. We went to parties. We started hanging out. We went to cookouts. We didn't wear our masks. We didn't social distance. A lot of it was done in private homes, and it was, all right? Or in places that were supposed to be one thing and turned out to be others. And a lot of it had to do with the youth. And a lot of it had to do with, there was a message put out in early June. We shifted our balance away from our focus away from coronavirus to something else. To something else. And everybody knows what that was. And we shifted our focus from it. And then everybody thought, well, no, coronavirus must be over. Therefore, I'm going to live my life. There is no boogeyman. It's us. And so we need to get back on that message. We need to stay at home as much as possible. We need to keep our social distancing. And we need to wear our masks, because if we don't want to shut down our economy and hurt ourselves and our neighbors, we need to act a certain way. And if we do that, if we just do that, we'll start bringing this level down, and we'll be able to control the corona. We'll be able to control the virus. We won't overextend our hospital and care system, and then we can move forward if we want to move forward. Right now, we're kind of step back a little bit, and we're holding on to what we got right now. So please, that's my plea to you, the media, the messaging. It's us, okay? And that's what we have to do.
Mayor, some of our Spanish language stations would like for you to repeat that in Spanish, if you could.
Okay. Todo el mundo está encontrando algo a culpar porque esto sucedió. Y la razón es muy simple. No es que no había suficiente contact tracers, aunque no hay, right? Y que los exámenes, todo eso, que no hay suficiente examen, que le toma mucho tiempo, etcétera. Esas son razones, pero son razones muy pequeñas. La razón número uno porque estamos en esta situación son nosotros. Y la manera que nosotros estamos actuando, que nosotros no estamos tomando esto en serio. No estamos manteniendo la máscara, la distancia, lavándonos las manos, y también teniendo fiestas y eventos sociales, todo eso. es la culpa de nosotros. Porque todo el mundo está asumiendo, bueno, no, este es mi amigo, él no tiene el virus, yo no tengo el virus. Nosotros tenemos que asumir que todo el mundo tiene el virus. Y nosotros, todos nosotros, nos enfocamos en otra cosa en el principio de junio, cuando empezó esto empezó en el principio de junio. Empezamos a actuar de una manera diferente. Todos los doctores están diciendo la misma cosa. Tenemos que actuar de una manera mucho más responsable. Tenemos que ponernos las máscaras. Tenemos que mantener la distancia social. Tenemos que lavar las manos. Y si nosotros cumplimos con eso, esas cosas nada más, que no son tan complicadas y que no van a afectar nuestra vida en una manera tan negativa, podemos bajar este nivel de contagio en este condado y podemos ser miembros de esta sociedad responsable, que vamos a cuidarnos a nosotros, que vamos a cuidar el trabajo, el empleo de otra persona, de nosotros también, porque si mantenemos la manera que estamos actuando y mantenemos este tipo de nivel, puede ser que tenemos que tomar otras medidas que yo no deseo y nadie desea aquí y que va a dar daño a la economía y también a nuestros vecinos. Eso es la explicación. Y no busque por otra razón. La razón somos nosotros. Nosotros tenemos que cumplir con las reglas para mantener la salud de nuestra comunidad.
Gracias, alcalde. We have a budding journalist with us today from Doral Academy. Ninth grader Eric Hernandez is working on a summer project with his TV production team, and he's joined us for the press conference, and he's very anxious to ask a question of you, Mr. Mayor. Eric, are you there?
Yeah, I'm right here. Well, as you know, that nearly 1 in 100 Americans have COVID. 1 in every 100 Americans has COVID. Well, how challenging has that been to control Miami-Dade County with these rising numbers and also hitting record numbers in the state of Florida?
Well, Eric, it's nice to see you and hope you have success in your future endeavors as a journalist. It's not only 1 in 100 people, 100 in the United States has COVID, a much higher number had COVID actually, because the actual number of people that actually have had it is much higher than the official number. Okay, and so a lot more people have had it, and yeah, it's a vexing problem. It's a very contagious disease and a virus, and it's novel, which means it's new, and we're trying to do the best that we can to make sure that our health system is always capable and able to help everybody who gets sick with this virus, and that way try to keep the mortality rate down that way and try to keep our citizens as healthy as possible. And our message again, Eric, is that we need to assume that everybody is contagious, that everybody has it, and we need to keep our social distancing, wear masks, wash our hands, and if we do that, we can get this virus under control.
Thank you, Mayor. Up next, Brian Brandell with the South Florida Business Journal.
Hi there. So short of ordering another stay-at-home order, which I know you don't want to do, are there any other restrictions that you are thinking about or your healthcare experts are thinking about that might make a difference if the numbers don't improve?
Like I said, just late last week, we had that conversation with our doctors and our advisors, and they all felt that we needed to kind of stand pat for about 10 days to see what happens with these measures. Because remember, we have a curfew. The curfew is meant to stem social gatherings. That's the reason why we got a curfew now. We also closed all of these, gathering places like casinos and movie theaters and all, where a lot of people would gather. And then we also closed the interior spaces of restaurants, because that's the only industry that I know of, or a business that I know of, that you have to take your mask off in an interior space in order to conduct your business, which is eating and drinking. And so it's a very dangerous situation. So right now, we will be talking again with our advisors and the hospital personnel to see what other measures we need to take. But at this point, no, I don't have a plan in place to close other things. At this point in time, that can change. And that can change. So I want to make sure people understand that could change. because we need to look at what's happening with the virus.
Well, for our healthcare experts, is there another step? Is there like, if for some reason what we're doing doesn't work, is there like another incremental step we could take short of a stay-at-home order?
I think Dr. Vialta, Dr. Elmir is still here. Can either one of
Remember,
you?
we always had a safer at home, but we never actually had a stay-at-home order. So there were businesses that were open that were essential. Okay, so you could always go back to that, all right, and have pretty good success with that with those orders. So, Dr. Vialta.
Yeah, no, definitely, Mayor. Thank you. And that's something that we're constantly discussing based on what's going on with the community, what's the positivity rate and the cases that we're seeing, to be able to identify it and take the appropriate steps to move backwards from our reopening. So that's something that we have to do in collaboration with our elected officials.
Thank you, Dr. Vialta. Gerald Vihana, freelance journalist with French Morning Miami. Gerald? Unmute your mic.
Yeah.
There you go.
Good morning to everybody. We all agree about the airborne situation and the situation also that when you eat, you have to remove your mask. So what about updating the guideline as far as proposing solutions for the future when we're going to reopen the indoor restaurant? So there is some science existing, which is to get some fresh air intake, get some UV sanitation into the air system, and also get some air purifier on the floor, or adopt or create some facial shield that we can keep while we're eating and drinking. By doing so, we cover all the areas that has been a very strong point that was preventing the indoor venue to open. So my question is, are we looking for solution in the future? Because if we're gonna go down into the testing and we reopen those places without changing the current guideline, we're gonna have the exposure again. It's not gonna change. So are we gonna do some change into updating the guideline?
That's for me. I'm always open to whatever changes. But again, the problem with the indoor spaces in the restaurant is that it was safe to reopen because the contagion level was much lower than it is right now. And again, I put the analogy of the pavement. You can take a curve at 40 miles an hour. The pavement is dry, and so at 8%, 7% contagion level, it's dry pavement. But you can't take that same curve at 40 miles an hour that's wet or maybe have snow or ice on it. And so right now the contagion level at 25 is like snow and ice. So that's the reason why it's not safe to go inside and not wear your mask, because the level of contagion in this county from the positivity rate we have right now is over 25%. That's the problem. And so it's the number of people that may be in that restaurant at any one time that may have this, that may have COVID-19. The probabilities are much higher than a much higher number of people in that restaurant have COVID-19. That's the issue. That's the problem.
I fully agree with you, Mayor.
Thank you, Mayor. Let's move on now to CBS News, Manuel Bojorquez.
Hello there. Thank you for taking my question. Question for Mayor Gimenez. We heard Dr. Abo earlier on the call say that we're seeing here what we saw in Wuhan in the winter. We all know that it took a pretty strict lockdown in Wuhan to control the virus. If people aren't following the guidelines, is that what it's going to take here?
I'm not going to say what it's going to take. I want people to follow the guidelines, and also let's see what these measures that we have taken, if they take effect and start to lower our contagion level. That's what we hope. That's what we expect. That's the message we want to drive also to our community, that we don't want to go further, but it's up to us to stop that by changing some behaviors of certain people in this community, and also that the people that are actually doing their part is assume that everybody has it and remember that. And then when you do that, you'll act a little bit differently too. So we don't want to go there. We obviously will be still talking to our advisors about it, but that's not something that we want to do. We really want to see what these measures that we have taken, if they will grab a hold and start to drive this level down.
But as far as those guidelines, we really have been telling people wear the mask, social distance, don't put yourself in any exposure if you don't need to. That message has been out there for weeks, if not months now. Why are people just not getting it? Is it a matter of enforcement?
Well, I think there's also been mixed messages. I think that in the beginning of the month, we focused on something else. We focused on disturbances and what was happening, around the country with disturbances, and we kind of took our eye off of the coronavirus, and we saw images of thousands of people marching, a lot of them not wearing masks, close together for hours on end. And so there wasn't much of a focus put on, hey, look, they're not wearing masks. Hey, they're not practicing social distancing. So people took that to mean, well, this thing may be over. And I think that you saw some behaviors change. And so, the emphasis on it may have gone away. And then now there's the emphasis, well, we don't have enough contact tracers and we don't have enough testing and that's not getting back fast enough. And now that's also a message telling people, well, if we have enough contact tracers and testing and all that, maybe this will go away. And that's not the right message. The right message is those are tools. That's not the reason why. We're the reason why. We need to change our behavior, and we need to go back to the things that we were doing as a community back in April and May, and that we somehow stopped doing sometime in June.
Thank you, Mayor. Another one in Spanish now, TVV Network, Emmanuel Villalobos. Adelante.
Hola, alcalde. Buenas tardes, ¿me escuchan?
Sí.
El gobernador Ron DeSantis ayer se mostraba preocupado por la falta de reactivos con el tema de las pruebas, de recursos se estaban agotando y que había negociaciones en la Casa Blanca para poder tener más reactivos en el tema de los laboratorios. ¿Cómo es la situación con el tema de estos reactivos en el condado Miami-Dade? Y si en algún momento pues ven que está mermando esta disponibilidad, pues quizás se pudiese dar un paso atrás en el que las pruebas solo se hagan a aquellas personas con síntomas graves o síntomas del virus directamente.
Si entiendo es algo, el gobernador dijo algo de la falta de reagent, right? Si no hay suficiente, entonces no van a tener los resultados lo más rápido posible. Si hay un tipo de crisis con el reagent que no tenemos suficiente, yo estoy seguro que el Departamento de Salud va a tomar ciertas decisiones, así que puede ser que la doctora Villata puede responder a eso.
Sí, gracias por la pregunta. El Departamento de Salud y también el Departamento de Emergencia en el estado de la Florida tienen que trabajar con el gobierno federal para poder identificar y comprar más reagents para que tengan los laboratorios, pero eso es algo que se tiene que continuar para continuar comprando y para que los laboratorios y los hospitales tengan lo que necesitan para procesar los laboratorios. Por eso sí, hemos oído eso y definitivamente el Estado tiene que trabajar con el gobierno federal.
Thank you, Dr. Villata. Let us go now to Doug Hanks from the Herald.
Mayor Gimenez, you mentioned protests and as well as sort of criticism over contact tracing as influencing perceptions on the mask rules. Did you take any steps with the White House to encourage President Trump to wear a mask? And do you think it would have been helpful if he had worn a mask in Miami-Dade County on Friday?
I already gave you the answer to that on written answer on that. So if you have something else to ask, we'll go.
But you didn't answer the question. Do you think it would have been helpful? And did you take any steps to encourage him to wear a mask in your communications with the White House?
Look, the President of the United States has extraordinary measures that protect him. Everybody that was on the tarmac, anybody that's anywhere close to the President of the United States takes a test an hour before seeing the President of the United States to make sure that they're not spreading any virus. He stayed 5-6 feet away from us even with that. And so they do a heck of a job protecting the President of the United States. And I was, he did wear a mask later. I saw him wearing a mask when he entered a medical facility, I guess in Washington, D.C.
Thank you, Mayor. So we are about an hour and 15 minutes into this, so I'm going to do one more question in Spanish, and then we'll wrap it up. Ana Cuervo from Channel 51.
Patty? Patty, when you're done, can we have Channel 7 question, please?
Sure. I didn't see your hand raised.
Okay, well, my video's muted. You muted my video.
I did? I'm sorry. Okay, Ana, I'm unmuting you. Wait, hang on. You're muted.
Alcalde, se ha hablado mucho de lo que es el cumplimiento y posibles multas, pero hay personas que cuestionan los números, cuestionan todavía la seriedad de esto. Por ejemplo, nos han llegado informes de personas que dicen, que alegan que tienen una amistad, algún conocido, que hizo una cita para hacerse una prueba, que no fueron a dicha cita, pero recibieron una carta con un resultado positivo. Eso es un rumor, se puede aclarar eso porque parece tonto hablar de esto, pero le resta entonces importancia a los números y la información que usted y los médicos están tratando de diseminar a la comunidad.
Sí, yo escuché ese mismo rumor y lo estamos investigando. Si hay personas que estaban en línea, nunca tomaron el examen, ahora tienen un resultado positivo. Pero mira, la prueba está en los resultados. La prueba es que hoy en día tenemos como 1.800 personas que están en el hospital con COVID-19. El número antes teníamos como un 20% de uso de los cuartos, un 20% de los usos de los cuartos de cuidado intensivo. Ahora estamos casi en un 90%, así que la prueba está en los resultados. Tenemos muchas más personas que están en el hospital en cuartos críticos, muchas más personas que están en el hospital con cuartos de intensividad, muchas más personas que están en ventiladores. Así que, sin duda, tenemos más contagio aquí en el condado de Miami-Dade, mucho más alto de lo que teníamos al principio del mes de junio. Y así que puede ser que hay incidentes limitados, pero de verdad eso no va a tener un impacto sobre lo que es los resultados. Sabemos que el porcentaje de positivo ha subido de un 8% en un periodo de 14 días a más de 25% que estamos hoy en día. Así que lo que estamos viendo es si ese porcentaje empieza a bajar y también que el incremento, el aumento de las personas que diariamente más y más personas están usando más y más camas porque están enfermos en nuestra comunidad, que si eso empieza a empezar a slow down y empezar a bajar. Eso es lo que estamos viendo para ver si eso sucede. Si no, vamos a tener un problema aquí con el cuidado, el tratamiento de nuestros pacientes, porque va a poner un tipo de presión a nuestro sistema de salud que no es bueno para nosotros en común.
WSBN, go ahead.
Hi, thanks, Patty. I just have two questions, one for the mayor and then one for the doctors, if they could, please. Mayor Gimenez, you tweeted, obviously we've covered a lot about the house parties that have popped up, not just in Miami-Dade, but in Miami and across Miami-Dade County during this time. You had tweeted over the weekend that you were hearing reports of many house parties. Obviously, common sense would dictate that these kind of events could be a problem. There's a little pushback. I know that the executive order that you signed last week didn't outright ban short-term rentals, but put a restriction on it for a minimum of 30-day stay. We spoke to Airbnb. We're working on a story. They call that too restrictive because they say, look, there's a lot of traveling nurses and doctors and a partnership with Jackson that would, limit some of this if the length of stay is only 30 days or longer. Obviously, the reason I know you want to, obviously shut down these party homes. Do you feel that there's any wiggle room there or compromise with short-term rentals or Airbnbs for some of the smaller locations, or do you feel that the 30 days is not too restrictive in terms of kind of the mandate coming down from the county?
Look, Airbnb only has Airbnb to blame for this problem. We've talked and said over and over again, this party home situation was a problem, not only for this pandemic, but for the basic disruption of neighborhoods. And they say, yeah, they try, but it's not happening, man. And so we've seen the images. We know that that's happening, and we needed to stop it. So that's why the Airbnb or the short-term rental order went out. so that we can, as much as possible, stop this, party house phenomenon that was happening around this county.
And then just to follow up, Patty, thank you for letting me, put in 2 questions here. For any of the doctors still on the line, has there been, obviously common sense would dictate that, party homes where, we've interviewed people, that neighbors that say there's dozens or even hundreds of people without wearing masks, no social distancing, sometimes inside, could contribute to the spread of COVID-19. But is there anything backed up in the data, doctors, that you're seeing either through contact tracing or through other data that would indicate that some of these house parties in Miami-Dade County could be responsible for some of the outbreaks in the recent months?
So thanks. So what we're looking at and what we're finding, we're able to identify from our case investigations and our contact tracing is that one, there's community spread. So there are individuals that may not know where they were exposed per se, but there are a good amount of individuals that were exposed because of their household. For individuals that, family members, especially if you're looking at individuals that live in a multi-generational home, it's very easily spreadable. So all you need is one individual who was not properly isolated, will able to contaminate all the other individuals that live in their house. So that's something that we're able to identify when we're doing those case investigations.
Okay.
Thank you, Dr. Villalta. And Mayor, I forgot, I knew that I thought that would be the last question, but I forgot that Erica was waiting for Channel 23 for a question that she had for you directly earlier when we were with the doctors. So, Erika Carrillo.
Okay.
Erika? Erica. I think she was trying to unmute.
¿Aló, me escuchan ahora sí?
Ahora sí.
Ok, gracias. Alcalde, hemos recibido quejas en los últimos 4 días. Una de ellas de verdad me impresionó. Un empleado tenía los síntomas, la empresa de transporte para FedEx lo obliga a tomarse la prueba, sale positiva y aún así lo obligaron a ir a trabajar ayer con positivo. Mi pregunta es, cuando el dueño de una empresa sabe que su empleado es positivo y lo está obligando a salir a la calle a trabajar con un caso de coronavirus positivo, ¿puede haber una pena criminal o algún tipo de sanción para un empleador que sabe que su empleado es positivo a coronavirus y aún así lo saca a trabajar a la calle? 2, le quiero tomar de nuevo el tema de Goodwill porque no le miento, por lo menos 6 quejas de 6 diferentes empleados. Otra también de Goodwill salió positiva coronavirus, tenía síntomas, aún así estuvo trabajando hasta el viernes en Goodwill. Goodwill nos dijo que es verdad, tiene muchos casos porque tienen adentro más de 600 empleados trabajando al mismo tiempo. La gente los empleados mismos tienen mucho miedo, no quieren perder el trabajo porque obviamente es un riesgo perder el trabajo en este momento, pero ¿qué va a pasar con un empleador que sabe que sus empleados están con síntomas, saben que están positivos y aún así los están haciendo ir a trabajar?
Buena pregunta. Tenemos que investigar primero el tema de FedEx, el empleador que, si FedEx le está forzando a sus agentes a trabajar sabiendo que tienen el COVID-19, yo creo que
es una empresa subcontratista. Yo tengo el caso, lo estoy trabajando y ese empleado obviamente está muy asustado de perder el trabajo, pero está trabajando positivo en la calle.
Bueno, dame los datos y lo vamos a investigar. Cuando hay una persona que es positiva, hay ciertos procedimientos que tiene que tomar la industria para sanitize el lugar, y esperamos que esa persona no va a estar ahí porque entonces va a contaminar el resto de la empresa. Así que si hay una regla, una obligación, un tipo de orden que prohíbe esto, lo tengo que ver. Es algo que no, puede ser que no lo pensamos, que alguien iba a hacer eso. Así que vamos a ver si eso está sucediendo y si tenemos orden en contra, pero de todas maneras, dame la información para que podamos investigar.
Thank you, Mayor. That'll do it for today. Thank you to you and to all of the medical experts that joined us today. Any parting words?
Yeah, I do. Actually, I have a parting word that I want to thank, Dr. Arbo, Marty, Villalta, Ferreira, all those that are part of our group. I mean, they've done spectacular work. I don't know how many countless hours they put in to this effort on the advising me, but also putting together all those rules and regulations that, if followed, would have kept us safe and are keeping us safe. And so I express my deepest gratitude to them and this exemplary work that they've done. So thank you very much. I really appreciate it from the bottom of my heart. And this community also appreciates your work. Thank you.
Thank you, Mayor. Have a good afternoon.